So gastroenteritis, we know inflammation of stomach, inflammation of intestine. It can be due to the multiple cause. It can be due to the viral infection. It can be due to the bacterial infection. Especially in children, it can cause a lot of dehydration. Yes. So again, our as per our golden rule, thank you for subscribing as prescribed. So we are gonna say yes to this one because lot of time you will see dehydration. Yeah, okay, lot of time you will see rapid hypovolemia in that patient, so administer IV fluid definitely. What about B, guys? Wait the child daily. What about B? Is it okay? Yes, especially in the children's, because we don't have any other measure of whether they are losing the fluid or not. So weight is actual good indicator of hydration status. Okay, so monitoring is good. Avoid giving oral rehydration solution. C, do we need to give oral rehydration solution or we need to avoid it? No, actually, we need to give it. So this is wrong. Um, D, monitor urine output. Yes, okay, because urine output is always the key indicator of hydration status. So we need to monitor whether patient is developing oliguria or not. What about E, teaching parent about proper hand hygiene? If somebody is having any kind of infection, is it important? Yes, okay, because hand hygiene is very important to prevent the spread of viral infection, bacterial infection, especially in the gastroenteritis. So we're gonna do that. Okay, let's move to question number 42. So the nurse review medication order for a patient with upper GI bleed. Which medication are appropriate? So we are having upper GI bleeding now. Okay, so which medication we can give to the patient? Proton pump inhibitor, can it help to reduce the bleeding? What about A, guys? Come on, guys, double tap. Yes, okay, because we know proton pump are used to reduce the acid production, and it will help to prevent the further damage to the gastric lining. We don't know where is the bleeding, so definitely it will help. Okay, definitely it will help. So just to reduce the damage to GI lining by acid. What about B, octreotide? We done yesterday. What about B, guys? We done this medication yesterday. Yes, okay, octreotide is actually specifically used for esophageal varices. Okay, it reduce the portal pressure, it reduce the bleeding. Yeah, so B is correct. Yeah, what about C, NSAIDs? Is NSAIDs are cause of bleeding or no? Okay, NSAIDs known to cause GI bleeding. So if somebody is already having upper GI bleeding, we really don't want to give them. Okay, it will increase the bleeding. What about D, antibiotic if H pylori positive? If somebody is having Helicobacter pylori infection, do we need? Yes, okay, especially if we are having that infection, we need to eradicate the bacteria and we will need antibiotics and antiemetics. Yes, because sometimes patient can vomit blood also, and that can be aspirate. So just to prevent the vomiting, it is good, and to reduce the risk of aspiration, so antiemetics is good. Thank you, guys, for double tapping. 8 more questions. A patient is admitted with acute appendicitis and scheduled for surgery. Which nursing intervention are appropriate before surgery? Select all that apply. So we know appendicitis, inflammation of the appendix, it is always a medical emergency and requires surgical removal. Yeah. So that's why is patient nil by mouth? Definitely. Before most of the surgeries, we need to have patient nil by mouth to reduce the risk of aspiration. What about B, guys? Administer IV fluid. Because now patient is nil by mouth, so it's always appropriate to give the IV fluid to prevent the dehydration. What about C? Apply heat to the abdomen for this for comfort. Is C yes, C no? Okay, so no to C because it actually can increase the appendix rupture. Heat always increase the blood flow to that organ. Provide IV antibiotic as prescribed. D. D yes, yes. Okay. D is always yes because it is lowering the infection, especially if it is ruptured already. Then it's gonna help to reduce the septic shock. And what about E? Monitor for sign of rupture. E also yes, yes. Monitoring always good. Increase in pain, fever, all those infection sign. Yes. Okay, let's move to question number 44. So the nurse is caring for a patient with acute diverticulitis. Which interventions are appropriate? Select all that apply. Inflammation of diverticula in the colon. A. Keep. Yes. Again, the ball need rest. It can be acute attack. So clear diet can be started once recovered, improved. So yes to A. Administer IV antibiotic as prescribed. What about B, guys? What about B? Yes. And we already discussed, like, if it is always prescribed, then we need to give it. Okay, so B is correct. What about C? Encourage high fiber diet during acute phase. C. What can happen? It can make worse. Yes, JJ. Okay, especially the high fiber. No, low fiber liquid diet can be recommended, but not the high fiber. And D. Monitor for sign of peritonitis, inflammation of peritoneum. Why it will happen, especially like if diverticula is burst and content is leaked into the peritoneal cavity, so there can be peritonitis, so we really need to monitor for that. Provide pain management. Yeah, bowel perforation. It can be severe, it can need pain management, so definitely. Okay, 6 more question, guys. The nurse provide teaching to a patient with diverticulosis. Which statement indicate correct understanding? So we are not having diverticulitis now. There is no inflammation. So when we are saying diverticulosis, that means like now diverticula just itself in the intestine, colon. So maybe we will not see the symptoms. So let's do that. A. I should increase dietary fiber gradually. Yeah. Yes, because in the last question we said like high fiber can cause the increase the problem. Okay, so it can worse. So we need to increase gradually. We can't have the high fiber diet. So A is correct. What about B? I need to drink plenty of fluids daily. Yeah. Yes, especially like If patient is taking the fiber and not taking enough fluid, then it can cause the obstruction. So that's why we need to make sure like this will not cause any issue. So if patient taking plenty of fluid, it will help to move the bowel. I should avoid seeds, nuts, and popcorn. Is there any indication? No, see, because we don't have any indication about these seeds, nuts, and popcorn that can cause diverticulitis. What about D? I will take daily opioid to prevent pain. What about D, guys? D, no. Okay, what's gonna happen? Because you're gonna see opioid, and that can cause constipation, and that can cause diverticulitis. Okay, so no. C is C is not correct. Celia, C is not. Okay, there is nothing related to seeds, nuts, and popcorn that they can cause the diverticulitis. Okay, as long as patient is having good bowel motion, it's okay, because this is not the allergy, and this is nothing related to absorption or not. So that's why they are not gonna do anything as long as there is no high fiber diet. Okay. uh, I will take daily opioid. D is no. Okay. I should engage in regular physical activity. What about E, guys? E is yes. Yeah, we done that before, because that will improve the peristalsis movement, that will help us to pass stool. Okay. Question number 46. So a patient is receiving chemotherapy for gastric cancer. Which side effect should the nurse monitor for? So now we are having patient with gastric cancer, but they are on chemotherapy. And we know nausea, vomiting is most common side effect. Yeah, everyone. A yes. A is yes. Okay. Always. What about bone marrow suppression? Can chemotherapy affect the bone marrow? Yes. Okay. So chemotherapy is known to suppress the bone marrow. This can reduce. That's why most of the patient have anemia and neutropenia and thrombocytopenia. Okay. They will have less white blood count. They will have less red blood count. They have less platelet. Okay. So always be alopecia. This hair loss, most common, most expected side effect. Yes. Okay. What about D? Peripheral neuropathy. Peripheral. Yes. Okay, because certain chemotherapy drugs can cause the nerve damage, and they can. Hyperglycemia. What about E, guys? What about E? Does chemotherapy cause hyperglycemia or hypoglycemia? Hypoglycemia or hyperglycemia? No. Yeah, it is no. Okay. It can cause hypo. Okay. Because why it will cause hypoglycemia? Because most of time after chemotherapy you will see nausea, vomiting. Patient doesn't want to eat. Some of the medication can affect the insulin production or glucose metabolism, that can cause hypoglycemia. Okay. And most of the time chemotherapy patients are on steroid medications. Okay, steroid, I know typically they cause like hyperglycemia, but then they have fluctuation, especially like in chemotherapy. Yes, calcium case shift after vomiting. Yeah. Okay, so most common cause of hypoglycemia in chemotherapy is nausea, vomiting. Okay, let's do 4 more questions. So, a patient with new ileostomy is receiving discharge teaching. Which instruction should the nurse include? Thank you guys for following. Really appreciate and double tapping. So now we got new opening into the small intestine just to divert the stool. Uh, so what's gonna happen with that? Empty the pouch when 1/3 full. Same like so now stoma is there. Yes. Okay. Otherwise it will burst. It will be too heavy. It will cause the skin damage. What about B, guys? Increase fluid intake to prevent dehydration. Especially because like if somebody is having the ileostomy, small intestine, the stool will be output will be very liquid. Okay, and that's why there is higher chances of dehydration. So make sure they are having the plenty of fluid. What about C? Expect liquid stool output. Yes, that's the one we are talking because it's coming from the small intestine. This is very normal finding because stool hasn't passed through the large intestine yet. Okay, avoid food that cause blockage like corn and nuts. D. Yes, D. Yes, definitely they can cause blockage. Okay, yeah, and especially something is like if there is a food that have high fiber, that can also cause a blockage. Yeah, and we don't want block JJ definitely. What about E, guys? The stoma should appear pale and dusky. What kind of stoma we want? We done same kind of question before. We need red or reddish pink. Okay, yeah, moist. Okay, so pale and dusky, we are having less perfusion to the tissues, so we don't want that one over there. Three more question, guys, three more question, and let's see what we can do next. We can do something we will see how we are doing. The nurse is monitoring a patient with an NG tube for gastric decompression. Which finding require intervention? Select all that apply. So NG tube, we done similar question before. Why we need intervention? Abdominal distension persistent. Yes, everyone happy with A because that's mean NG tube is not working. Okay, it should relieve the abdominal distension. It should not persist. What about B? NG output is green and watery. Is it common finding or not? Expected, yes, so that mean it is working. Okay, so no. The patient has difficulty breathing. C. So if somebody is having difficulty breathing after NG tube, then it is issue. Okay, so we don't want that. It can be like NG tube is now in trachea. Yeah, so C is concerning. The tube is cured and draining. So tube is cured, tube is draining well, so we don't need to worry about that. Yes, D is no. Thank you, guys. The patient developed cracked lip and dry mucous membrane. So now we are having too much fluid coming out. Patient is not drinking enough. It is sign of severe dehydration. We need to increase the fluid administration. Okay, so assessment dehydrated definitely. Okay, so E is correct. So I will post all these questions on our YouTube and it will be uploaded by tomorrow. So the nurse review the medication list of a patient with GERD, prescribes metadine. Which medication may cause interaction? So we know this is H2 blocker. It helped to reduce the stomach acid. Okay, so we done this medication in our pharma session. So what interaction it can cause? Can it cause? And if somebody remember why we need to worry about this medication? Anyone? Okay, because we learned about in our last pharma session, we learned about CYP enzyme. Anyone remember CYP enzyme? Anyone here? CYP enzyme? Yes, JJ. Okay, so CYP 450 is responsible to metabolize number of medications. Okay, so this medication, when we give this metadine, where it is, um, it inhibit the action of CYP 450. Okay, so this enzyme is gonna, when this enzyme is less in body, then it's gonna increase the accumulation of drug, because there is not enough metabolism of those drugs going on. Okay, warfarin. So now we need to know, is warfarin get metabolized by this enzyme? Yes. Okay, so most of the medication get metabolized by CYP enzymes. Okay, so warfarin, yes. Okay, phenytoin, yes. Theophylline, yes. Okay, only vitamins and calcium supplements are not metabolized by this one, so there will be no significant interaction. Okay, so please remember CYP enzyme, because in NCLEX also, I know you don't need to name this enzyme, but you will find number of questions like why and how you gonna find the interaction. Most of the time we only learn don't give this medication with this medication, but we need to know as a nurse, like how it happened, why it happened. So start asking yourself question why it happened, and you will know. Okay, so remember CYP enzyme, it study about it. I might will post a video on YouTube also about that one, because this one is so good to learn. Okay, and which medication, yeah, know the why. Once you know the why, NCLEX is nothing in front of you, honestly. I will make a video on CYP, and I will put it over there. Okay, promise this video will be there also. Okay, last question for today. Last question. A patient who had gastric surgery is at risk for dumping syndrome. Which patient teaching points should be included? Select all that apply, guys. We know dumping syndrome. CUPY 40. I don't think so. CYP have different numbers in front of them. Yes, JJ, it is on pharma document, because I included in that booklet which one we need to worry, which we don't need to worry. Okay, so that's why that booklet is very important. If you anybody, yeah, yeah, they can have different number. There are different enzyme. Okay, so if anybody interested to buy my pharma booklet study guide, please let me know. That will usually go through DM. Okay, dumping syndrome. So dumping syndrome, very common complication, especially after the gastric surgery. We already $10, guys, $10, Maria. So yeah, and that will give you overview about all the pharma. Eat small frequent meal. We just done dumping syndrome before when we done the gastric surgery. What about A? Yes. Okay, so A is correct, because it will help stomach empty more slowly. If you are eating too much, stomach will empty fast. Okay, so A is correct. Lie down after meal. Is lying down after meal can slow the stomach emptying? B is yes, guys. B is yes. Okay, if you are walking, if you are standing, then stomach will empty fast. When you are lying down, when you go to rest, stomach will empty slow. So lie down after meal, just to prevent the dumping syndrome. Avoid simple sugar. The most common trigger of dumping syndrome is simple sugar. Okay, you don't wanna have sugar. That's why We need to avoid high sugar food, especially the quick snacks, if patient is having or nearly having dumping syndrome. Okay, so always avoid. Drink fluid with meal. Do we need to drink fluid or do we need to avoid drink fluid? Avoid. Okay, so we need to avoid drinking fluid with meal. What will happen to them, because they will empty too fast? So it should be like 30 minutes before or after the meal. Okay, so not together with meal, because stomach will not fill properly but empty fast, like there will be less food content over there. Oh my god. What about E? Increase protein and fiber intake. Is E yes? Thank you guys for following. Really appreciate. E is yes actually. Okay. You need protein for healing. It take time. You don't need. That's why we don't give the simple sugar, because it will digest fast. It will, like give the indication like, okay, food is coming, and empty fast. When you will give the fiber, it will slow down the movements. Okay, so fiber is always recommended. Protein is always recommended. So E is actually correct. Okay guys, so this is our session for GI medications, and